So our last speaker for this first day event is Gian Turner. So unfortunately, she is not in the session. So she has shared her pre-recorded session. So if you have any questions, you can post in the messages tab so that I can email her with your questions. Thank you so much. So our host Sabia will share the screen.
Here is the introduction of Jean Turner. Jean Turner is a RN, MS, HNB to BC National Board Certified Holistic Health Nurse and Wellness Coach and Adult Gerontology Nurse Practitioner candidate, spreading the message that health is multidimensional and that an imbalance in any one of these areas body, mind, spirit creates disharmony throughout one's entire being. With an attained Bachelor of Science in Nursing degree from the University of Texas, a Master of Science degree in Healthcare Management from Troy University, National Board certification as Holistic Health Nurse and Nurse Coach, Breastfeeding Educator, and membership in the American Holistic Nurses Association. She possesses an extensive nursing background, a decorated Army and Iraqi war veteran who also has a history in providing humanitarian nursing support. She now shares her knowledge as a media host in podcasting and internet TV. This is the introduction of Jean Turner. Thank you so much.
I am back. So now we are playing the recorded session of GN Turner. So just bear with us for 1 minute. So she is the last speaker for this first day conference.
Hello and greetings to you all there in Croatia, here in the United States, and around the world. Thank you to WYN Conferences, to this wonderful organization for hosting this nursing and nursing education conference in Croatia. I wish I could be there physically with you all, but we're unable to at this time due to scheduling conflict. But I am grateful to be here before you today. It's such an honor and a privilege to serve in this capacity and to share my nursing knowledge and expertise with you all. And so I am Jean Turner. I am known as Nurse Coach Jean. I'm also known just as Coach or Coach Jean by many here in the United States. And I'm coming before you today here from Atlanta, Georgia, USA. And I would like to present on the topic, the cancer cam culture, complementary alternative medicines and modalities, and overcoming barriers in communication to promote safe, person centered care for cancer cam users. And I decided to talk on this topic, number one, based on an unpublished mini research project that I recently did, as well as come to you from a registered nurse patient perspective. And so, our objectives are as follows. I'm going to attempt to explain what I call, I didn't get this from a publication, this is what I have named the cancer complementary alternative medicine modality culture, the cancer cam culture. So I'm going to explain what that is. I'm going to identify reasons for CAM use, why many cancer patients are turning to complementary alternative medicines and modalities. I'm going to discuss the theoretical framework behind my unpublished mini research project that I did. I'm going to describe types of CAM and examine our role as professional nurses in assessing CAM use within our patients, as well as explain implications for nursing practice going forward. But first, a little bit more about me. I am a 35-year career professional nurse. I started my nursing career in 1987. Yes, I am dating myself. I am also a retired Army Nurse Corps officer here in the United States military. I am currently enrolled after all these years, enrolled in an adult gerontology nurse practitioner program. I am the host of my own podcast, Health Chat with Coach Jean, internet radio and global podcast show on a plethora of podcast platforms. I am an author. I am an international speaker, a licensed minister, and the Chief Wellness Officer of Spiritable Warrior Life Enterprises here in the United States. And all of these things fall under the umbrella of Spiritable Warrior Life Enterprises. This is where I practice my board certification as a holistic nurse, and I provide nurse wellness coaching and support for those of us who are 50 years young and beyond, with special emphasis on supporting patients undergoing cancer diagnosis and treatment, as well as those that are dealing with heart disease, helping them to improve their quality of life and, and it just improving their overall health so that they can be the healthiest versions of themselves that they can be. And last but not least, I am part of the Cancer Cam culture. Yes, I am part of the Cancer Cam culture. So in 2018, I was still in the military. I'm a marathoner, former marathon runner, half marathon runner. I was in perfect health, not on any medications. I had no medical problems. And then suddenly I was diagnosed. They found a spot in my lung. And so after months of monitoring the spot that was doing nothing for months on what I thought was going to be my final PET scan, because everything was going to be good, come to find out that tumor grew close to 3 centimeters, and they were able to finally biopsy and told me that it was malignant. So they removed the tumor. I ended up going through 9 months of grueling chemotherapy treatments. At the end of those 9 months of grueling chemotherapy treatments, about 9 weeks from the day that I got to ring the bell, signifying my last chemotherapy treatment, I went into cardiac arrest at the local hospital. Come to find out I had congestive heart failure. Now, many of you probably saying, you know you have congestive heart failure, you have signs and symptoms. Well, let me tell you, not all patients are alike. My signs and symptoms came on very rapidly to the point to where I did go to see the doctor. They gave me some pills, and I took the pills. I took one of the pills anyway. And within a matter of 0 to 5 seconds, I found myself in an emergency room, not feeling my best self. And a couple of hours, about 8 hours after spending 8 hours in the emergency room, and they finally called me back to triage me en route to the back to be triaged. I went into cardiac arrest and woke up in the ICU 2 weeks later. Now, that is my story, my testimony. And the congestive heart failure was brought on by the chemotherapy treatments. Fast forward to earlier this year, I am now dealing with a situation that, according to my oncologist, was brought on by those chemotherapy treatments back in 2018 and 2019. That is my brief testimony, and I'm really glad to be here. And just recently, because this is near and dear to my heart, just recently I conducted what I call a mini research project. And as you know, with any research that we do, you have to start with a review of the literature. Everywhere you turn, at least to me, every time I turn around, I'm hearing of someone I know or their family member or someone they know being diagnosed with cancer. Now more than ever, more and more people are being affected by this disease known as cancer. And in accordance to the literature, it is estimated by the World Health Organization, the CDC here in Atlanta, Georgia, here in the States, and other health organizations. It has been predicted that by the year 2025, so we're talking in 3 years from now, there will be greater than over 20 million new cases of cancer. And even that, they are saying, is likely to be surpassed. That's scary. Cancer is a disease that doesn't discriminate. It doesn't care how young you are, it doesn't care how old you are. It affects people throughout the age continuum. It affects pediatrics, it affects obstetrics, it affects the young, the middle age, our gerontology population. And so the literature also alludes to this, what I call the cancer CAM culture, because quantitative studies conducted over the last 5 years points to a prevalence of CAM use among cancer patients. Anywhere between 70 to 80% of patients, according to the literature over the last 5 years, 70 to 80% of cancer patients are seeking or have sought non-conventional ways to help treat their cancer. That is the research. And so there are many reasons that patients are choosing to use some form of complementary alternative modality or medicine during cancer treatment. What you see posted here on my slide are just a few. Managing symptoms, I can tell you now, in my mini research project that I recently conducted, 60% of those, 60% of my sample population said they use some form of CAM to help combat or to help manage the side effects of chemotherapy and or radiation treatments, with the number one side effect being nausea and vomiting. And in an article published by BMC, Complementary Alternative Medicine, is an article within the last 5 years, I think back to 2017, 2018. In their literature, 81% of patients said that CAM, complementary alternative medicine and modality, fit more in line with their personal belief systems. And that 42% desire to maintain some control over their body and have some say in their health decisions. They wanted to have some say in the decision-making process. Now, this desire goes into overdrive during a time when it seems as if everything else in one's life is spinning and spiraling out of control. I can relate. And as a holistic registered nurse, board certified here in the United States as a holistic registered nurse, look, I look at the physical, the mental, the spiritual, the emotional, the economic, the finance. We have to begin to look at, we have to go back to a time to where nursing, as professional nurses, we looked at the whole person, body, mind, soul, spirit, every dimension of their lives. We have to go back to seeing things from the patient's cultural perspective. The patient as a whole, holism, the whole person, the whole being, patient as a whole. So it's from that perspective. If we are to overcome barriers, we have to begin having these discussions with our patients. We must first understand that cancer affects every aspect, every dimension of the patient's life. That's number one. And it creates feelings of fear, feelings of uncertainty. And so one of the reasons why many cancer patients are turning to CAM is to maintain hope, to have that hope, right? They want to maintain control because there is such thing as a health locus of control. Some of us believe that our health is controlled by external forces. Some of us believe our health is controlled by internal forces. But that health locus of control, it is important because a cancer diagnosis, the treatment, there is uncertainty, a level of uncertainty that comes with that is not experienced in any other diagnosis or with patients that have any other diagnosis. So there's feelings of fear and uncertainty. And Michelle's, and I'm probably mispronouncing this theorist's name, but it's Mischel, his or her uncertainty in illness theory speaks to this uncertainty, which is a common psychological reaction to cancer diagnosis and the treatment and the whole cancer journey. And he defined it as the inability to determine the meaning of the illness, the meaning of the related events, and accurately be able to anticipate or predict the health outcomes. And it can be presented or present itself at any time along the cancer journey. And this correlates right here to this sense of losing control, which is one of the reasons cancer patients turn to CAM to help maintain that sense of control. And as professional nurses, we have to be able to recognize and facilitate management of this uncertainty amongst our patients that's within our patients. And keep in mind, it's not just the patient, but their partner, their caregiver, the family. They are also experiencing this uncertainty. This is also important if we are to overcome barriers and provide safe, person-centered care as the partner, the spouse, the caregiver, whoever the caregiver may be. It may be a husband, may be a wife, it may be a grown adult child, but whoever that other person is, we have to also recognize the partner in this, the caregiver in this. And so again, these are just some of the reasons that you see before you on my slide why patients turn to CAM. But I elaborate a little more on this other than what you see on the PowerPoint slide to give you an idea, to give you more of an understanding of how much more deeper this runs. Give you a greater understanding as a caregiver, as a professional registered nurse who is also a patient. And so let's talk a little bit more, if you will, about this improving of quality of life during a cancer diagnosis and treatment. And so patients choose CAM to help improve quality of life and to maintain some control. For me, there was nothing more humiliating than for someone else to have to bathe me. There was nothing more humiliating that I ever experienced in my life than for my husband, and when I was in the hospital, for others to have to bathe me and do everything for me. And so when we think about self-care, which is the buzz phrase for now, self-care, everybody's talking about self-care. Many of us automatically in the nursing profession, we think ADLs, activities of daily living. However, in accordance to Orum's self-care deficit theory, self-care includes all the activities of daily living, all the activities that an individual initiates and performs in order to maintain life, in order to maintain their health, and in order to maintain their well-being. I'm going to say that again. It is more than just the performance of ADLs. It is the practice of activities that our patients, that an individual initiates and performs to maintain life, health, and well-being. And so, if I was to ask 5 of you here in the audience today, what does that mean to you? What does that look like for you to maintain life, health, and well-being? I guarantee you I would get 5 different answers. I would get 5 different answers. Why? Because health and well-being means different things to different people. Health is not one-dimensional. One size does not fit all. And this is another reason why many cancer patients are turning to CAM to use in conjunction with conventional medicines, because one size does not fit all. But as patients, we are sometimes treated like the next patient and the next patient and the next patient. Inquire as to what that looks like to your patient. What does health and well-being look like for them based on their personal values and belief systems, based on their culture, based on their family dynamics, and everything else that is near and dear and important to that patient. And so I just want to briefly go over types of CAM. You all are probably familiar with this, especially overseas, where CAM is more accepted by the medical community than it is here in the United States. However, here in the United States, CAM is not recognized as therapy for the most part, but slowly but surely, insurance companies here in the States and some providers have begun to recognize at least many of the body-based practices such as chiropractic and osteopathic manipulation, massage therapy, and reflexology. So, some insurance companies here in the States are beginning to pay for that. Some of our providers are recognizing those body-based practices. Overseas, a lot of y'all live in countries that are more forward-thinking. Many countries, and my research and research that I've conducted, they do include acupuncture as part of a treatment plan, and many insurances in other countries are paying for that. In other countries, insurance is paying for some of the other types of CAM, some other CAM modalities. But here in the States, we still have a long way to go. And so, the movement therapies include yoga and Tai Chi. Energy-based methods include acupuncture. The mind-based include meditation, to include mindfulness meditation, hypnosis, prayer. I just recently read an article on intercessory prayer and how that helped patients with breast cancer to cope better with the diagnosis and the radiation treatments. Guided imagery is another mind-based practice. That is when you evoke mental images to help stimulate emotions within the patient, help stimulate feelings within your patients. And I like to do this with patients that I do nurse wellness coaching with, because it helps them to envision where they are desiring to be in their life, helps them to envision the desired outcome instead of focusing so much on where they are now, but helps them to focus more on who they want to become and where they want to end up at. And so, according to the literature review, about 80 to 90% of the most widely used complementary alternative medicine modalities is herbal therapies, is the natural products, the herbal therapies. And unfortunately, many patients believe that just because something says natural, that it's free from risk. And we know that that is not true. Everything has a risk associated with it. And so some of these herbals, because many of these herbals are things that we don't even think about, okay? So I want to enlighten you. Some of these herbals include your vitamins, your minerals, your supplements, herbal teas, right? Many of us drink green tea, black teas, these different teas, chamomile tea, lavender tea, and we don't think that it's an herbal, and patients who are undergoing conventional cancer treatments are drinking these teas, not realizing that it may cause a reaction, have an herbal drug interaction. It may interfere with their conventional cancer treatments. So we have to be more knowledgeable and cognizant that these herbal teas, these tinctures, essential oils, yes, those are considered natural products and herbals. These balms and ointments here in the United States, where CBD oil is so popular, even these, that we rub on our skin, apply to our skin. Our lotions contain certain herbals that we use that get absorbed in the skin. That can interfere can interfere with cancer treatments. Another one is these bath bombs. We buy bath bombs, because we want to relax, do a little self-care, we call it, and take a nice hot bath after a long day. And so we're throwing a bath bomb in our water, right? Not thinking that if it has CBD or some type of herbal in it, and a patient is on chemotherapy or taking radiation or hormonal therapy, some type of cancer treatment, that even something as simple as that could possibly interfere with their cancer treatments. And so this is why communicating with our patients is key, because many of these seem harmless. They seem completely harmless, but can cause interactions, negative interactions with chemotherapy treatments. and can decrease the effects of the conventional cancer medicine. Just to name a few. But I want to make you aware of this because we've got to come away from this thought that, well, there's not enough evidence, there's not enough scientific research and evidence to support CAM use, especially herbals. So I'm not going to discuss it with my patients. I was the one that had to bring it up with my oncology nurse. Yes, I was the one. She said, any medications you want, Miss Turner? I told her the medications, and I told her I was taking wheatgrass, turmeric, this, that, and the other. She would have never asked me. Never asked me. And so throughout the research, the literature review that I conducted, it was evident that throughout research, the availability for quantitative research on CAM use among cancer patients is limited. It is limited. And it is these limitations right here that have led to a lack of patient support from those who practice conventional medicine, us nurses who are at the bedside or in primary care or even in nursing education. Look, it is this lack of literature, this lack of evidence, okay, that makes many of us turn our nose up and not have these discussions with our patients. And so what this does is, number one, it impedes the communication between us and our patients and providers. It impedes or halts or prevents further study, further research into this matter. It halts that. It limits further research that would promote greater evidence-based information that would help our patients in the long run and help them to make safer, greater informed decisions when it comes to using these complementary alternative therapies. So it is important, it is very important as nursing professionals that, number one, we need to assess at every patient touch point. I don't care if it's oncology, I don't care if it's labor and delivery, because more and more women in childbearing years are coming up with breast cancer. I don't care what area of nursing that you are the SME, the subject matter expert in, that you are practicing in. At every patient touch point, we need to be asking our patients, do they use herbal supplements? If so, which ones? Are you practicing some type of complementary alternative therapy? Do you do acupuncture? Are you getting massage? All of these that I went over with you on the previous slide. We need to be asking our patients these questions. And we need to come from a non-judgmental standpoint. We have to begin to understand the factors that influence our patients' decision making, that influence their quality of life. We have to begin to try to empathize with our patients, bring back empathy and empathize with our patients, and be willing to listen to them. Be willing to listen. Don't dismiss them, but be willing to listen. And then we have to be willing to learn more about the commonly used herbals and what the herbal drug interactions are. We have to learn more about these other therapies that are out there that our patients are implementing, and be able to provide our patients the knowledge, the education, and information from reliable sources. Provide them with reliable resources. And so this has implications for practice. Because guess what? CAM is not going anywhere. CAM is more popular now than ever before. It's not going anywhere. And so if the number of patients who's going to be newly diagnosed with cancer or cancer diagnosis is going to be greater, they're predicting greater than 20 million cases worldwide in 3 years. And we know cancer does not discriminate. People across the age continuum are being diagnosed daily with this dreaded disease. And so patients have a right. They have the right to seek out that which they believe may be best for them, which they believe may be beneficial to them, that they believe is conducive to their health and healing and wholeness. And so when we talk about implications for practice, I want to focus on these four categories real briefly. Person-centered approach. Implications for practice. We have got to begin to take the time to explore our patients' feelings, to have open communication with them, and aim to get an understanding as to why the patient is choosing or has chosen this route. Patients are individuals. No two patients are alike. And each and every one of us have the right to be involved in our own care. Nursing education. This has implications for nursing educators, nursing faculty members, those in charge of nursing units, nurse managers, those in charge of your hospital education and training departments, nurse executives, nurse CEOs, whatever your capacity is, there is a need to include CAM and herbals, medicines in our nursing pharmacology courses, in our nursing curriculum as a separate course. There is a need to educate our nursing staff through continuing education courses, through lunch and learns, to help increase awareness of CAM, what it is, why it's being used, drug interactions, find out reliable sources and resources. But we've got to learn how to communicate with our patients and communicate with them in a way that is non-judgmental, that is empathetic. But we have got to start including adequate training for our nursing staff and all patients. So therefore, it's a non-factor. I don't need to know about it. I don't need to discuss it. That is not the right answer. That is the wrong answer. There is a need for further nursing research in this topic because more and more people are using CAM. The research demonstrates that more and more people are using CAM in conjunction with conventional cancer treatments. And so we need research that examines the safety and efficacy of CAM, period, point blank, and the use of it within our cancer patient population. And so there's also a need for nursing research to explore, communication barriers and help break those barriers and come up with a communication process, a process for how we can effectively and empathetically communicate CAM use, the patient's CAM use. And so for more information on CAM, complementary alternative medicines and modalities, here are just three websites that you can go to learn about herbs and other products. That first website is Memorial Sloan Kettering Cancer Center out of New York. That is the website. And then they have discussions with patients and healthcare providers. That cam.cancer.gov. That is the Cancer Institute and Office for Cancer and CAM use. And then another research-based information resource is that third one right there, which is the National Institute of Health. And so these are just some resources. There are plenty more, but time will not afford me to share them all with you. Here are some references that I use that you can go back to and pull up and read for yourselves, all taken out of journals, evidence based journals on complementary alternative medicine, the Journal for Nurse Practitioners, the scope of practice for us who are board certified holistic nurse health and nurse wellness coaches, as well as the Annals of Palliative Medicine. These are just some of the references that I use in my mini research project that I did just recently. And so to connect with me, Coach Jean Turner, my website is www.spiritofawarrior.life. On social media, I am on Facebook and on Instagram as well, under Nurse Coach Jean. On Facebook, Nurse Coach 63, which is also the page to my global podcast show and internet radio show. And also on LinkedIn at Nurse Coach Jean, Twitter at chat_coach. And if you're on Clubhouse, I'd love to connect with you as well at Nurse Coach 63. And so I want to thank WYN Conferences, this organization, for allowing me to share this information with you all. I pray that it's my hope that something shared as stimulated, as enlightened, and will encourage you to go forth in your practices with this in mind, because CAM is not going anywhere. It is being used more and more every day, and not just in younger folks. Let me say this in closing. The research points that more and more of the younger generation, the millennials, are using CAM. But can I tell you, in my mini research project, my sample population were 30. I think the youngest was 37. The oldest was 70. So CAM is being used even in our baby boomers and the older population or gerontology population. And so again, I am Nurse Coach Jean Turner. Thank you so much for allowing me to share. Grace, peace, and health to you all.
So, hi Jean Turner. Thank you so much. It's really wonderful presentation. So, you gave a terrific presentation by this closing ceremony. So here is the question from our audience: what is the most important mind-body intervention? You are on mute, Jean Turner. Jean Turner, are you there? Hello. Okay.
I'm sorry, I had to just turn down some sounds here. I'm here. Hello?
So yes. Yeah, we can hear you, but we cannot see you.
Oh, do you want to see me? I look a mess.
That's okay, but still you look beautiful, no problem.
Let me see. Okay.
You look beautiful.
Oh, I had a doctor's appointment today and I got shots and I'm kind of out of it. I'm so sorry.
That's okay. That's okay. So thank you so much for sharing your story. So it's really wonderful presentation. So and we have a question from our audience. So what is the most important mind body intervention?
The most important, well, that is very subjective. So if you ask me, the most important mind body really has to do, for me, with my faith and my spirit, because also in the research, a lot of people undergoing a cancer diagnosis, um, they turn that to their faith. They turn to their faith for hope, you know and so it helps them to deal not only with the diagnoses, but also with the treatments, and so that hope that brings to many people, And I know for me that that helped me so much in my journey. So, I would say that, but I think it's very subjective. I really believe it's very subjective and dependent upon the patient. But there is that mind body connection, though.
Thank you so much. And you take care, and God is with us. God is with us. Bye bye. Have a great day.
You
See
too.
you.
Have a good
See
night,
you.
everybody.
Yes. Yes. So we have done with the session, with the last session as well. So thank you so much, powerful ladies, for being this so wonderful for this one conferences. So thank you for being with us today. So this has been a wonderful conference. Thanks to all the people who helped us either directly or indirectly to make the conference successful. It's been a pleasure being with all of you today. This wouldn't have been possible without the support of each one present here. I would like to express my gratitude to all esteemed delegates and speakers of the conference for their presence and contribution to making this conference a great success. So, so, so this day one we have successfully completed. So let's wait for the day two. So see you tomorrow. Until then, good night. Bye bye.